Hi, I'm Yael Maxwell at TCT 2014 in Washington, D.C. Here at TCTMD, we talk with many of the world's leading interventional cardiologists. But what about those of tomorrow? I've rounded up a group of fellows poised to rise to the top of their field to speak about their experience at the meeting, personal and professional challenges, and much, much more. This is Fellows Forum. What is the biggest challenge facing interventional cardiology fellows today?
Sleep. It's finding the right fit for us after graduation.
And the other thing is you're having a lot of new techniques, new technologies, like the structural field, the peripheral field. So maybe 1 year of training is not enough, and you'll need an extra year of training to, master more techniques and get the volume you need.
At the same time, as we are growing older, we have other responsibilities at the personal fronts, where we have families, we have kids, and the stipend that we get is probably most of the time not enough to support families while you're still trying to get education. So your family is kind of waiting when you're going to start earning money.
Why do you think there is such a wide gender gap in interventional cardiologists, and how do you think the field might change to attract more women trainees?
Yeah, so it's definitely a male-dominated field. I mean, part of it is if you're a woman and you're trying to, come up with your training, it's always difficult in the field where we're standing in front of an X-ray tube our entire lives. And if you're interested in family planning and things like that, it can be very difficult.
It's a matter of finding the balance of what you want to do and how much you want to balance your family life with your professional life. And I don't see that there should be any difference. And I hope and wish it changes.
I think when we see close adherence and practices to more safer working hours, which is a major issue in Europe and has been built on at the moment and has been more developed in the US, I think we will see the ability to practice interventional cardiology in a way that is not as difficult from a lifestyle perspective, and that will then introduce, I think, a narrower gender gap.
If you could design your optimal interventional cardiology training program, how would it be different from what you're currently going through?
I will definitely make it a 2 required years of interventional program, not elective or not subject to change.
I always thought that if it was a combined program of internal medicine and cardiology, if it can be shortened from 6 years to 4 years, that would really take off a lot of time spent.
I think it's about balance. I think it's about performing your training when you are at least close to your optimal performance levels. And I think a combination, as ever, of hands-on and core didactic teaching is optimal.
But I like the way the training program is set up now. I love being in the lab, and it's working out great for me.
How do you see the field changing in the next 10 years?
I think technology is going to become so developed now that in the next 10 years that there's going to be miniaturization of these devices, more sophisticated techniques which can be done with much more minimal invasive routes. So that would take care of the vascular complications associated with TAVR and mitral interventions.
So I think we're getting so good at treating coronary disease, it now almost seems as if it's like a afterthought, but that still is our basis. But I think branching out into these other fields is where we're going to go. And it's an amazing time to be an interventional cardiologist because we have all these other opportunities, and it's for me it's great. That's what I'm looking forward to.
Academia-wise, I think funding will have more funding from NIH or from pharma or from any device companies. So this is going to be a very interesting and evolving field.
Ultimately, our main goal may be to put ourselves out of business, to address the patient at an earlier time point in their disease process so they do not present to us as an acute presentation event.
What are your thoughts on how new technology is changing cath lab practices?
Oh, I think it's changing tremendously. I mean, the things we're doing right now are, especially like the TAVIs, the mitral clips, the appendage closure, it's just, you're changing the landscape of intervention cardiology from invasive to minimally invasive, and it's outstanding.
Some of the newer devices that are coming up, like vascular closure devices or for that matter imaging devices, are much more easier to learn compared to what they were 10 years ago.
We are making the complex simple, not to degrade the skill that is required, but the complexity that we are addressing on a day-to-day basis is so much more than what it was. And we are doing it with somewhat ease, I'd like to think.
Are you for or against the American Board of Internal Medicine's new maintenance of certification requirements?
I'm against, and I think this is so much burden on us.
I truly believe in lifelong educational learning, but I believe the current setup needs to evolve and change to be more dynamic and responsive to the needs of physicians and how they provide care to their patients. Because ultimately, that's our goal. It is not to tick a box in some administrator's office.
I'm not against being tested, and I feel that every doctor should be updated. Every doctor should have the best current knowledge. What I'm against is the cost associated with it.
There's definitely a role for the idea of maintenance of certification. I just think we just need to figure out a better way of doing it.
What advice would you give to a medical student or resident considering specializing in interventional cardiology?
Don't do it. No, I'm joking.
Spend time in the lab and speak to your patients. Try not to speak to the fellows. They'll give you a somewhat skewed version of what life is like in interventional cardiology.
Expose yourself as much as you can. Don't make decision early in the career till you go into cardiology and experience it before making calls EP or interventional or imaging.
Come into this field only if you're passionate about it, because there might be days and hours that you spend away from your family and kids. But as long as you love it and as long as you love your patients, you'll have a good time.